Welcome back. This is Dr. Jin Sung, and this is Tuesday at 12:30. A lot of you know that we talk about functional medicine, nutrition, and taking care of those chronic complex patients in terms of diet and nutrition. What a lot of patients don't realize, or viewers don't realize, is that we also do something called functional neurology. So today I'm going to make a connection between functional medicine and functional neurology, and we'll do a little fun exercise to see if you guys can pass some of the exams that we do in our office. Okay, so when we have a patient who has gluten problems or bread problems or white flour problems, and they have gluten sensitivity or celiac disease, what they do not realize is that those gluten sensitive patients also tend to have issues with their thyroid. So when you look at the amino acid sequencing of gluten protein, large chunks of the amino acid sequences look like the thyroid gland. So let's say if you have gluten sensitivity or celiac disease and your immune system is reacting to the gluten proteins, then it may react to your thyroid gland because the amino acid sequencing looks very similar in large areas of the sequencing. Okay? What they also don't realize is that those amino acid sequences also look very much like the cerebellum, or the balance areas of the brain, right? Simply put, balance area of the brain. So the gluten protein amino acid sequences look very similar to some of the thyroid gland, and the thyroid gland looks very similar to the cerebellum. So you have this connection of food sensitivity, thyroid issues, and then cerebellar issues, right? So if you have an issue with foods, certain foods that look like your tissues or your regular, liver or kidney or whatever it is, it may also create an autoimmune attack on those tissues. So when we have a thyroid problem, we have to say, does this person have a gluten problem? And do they have a cerebellar problem, right? So the functional medicine aspect of it, we look at what is triggering the autoimmune response to thyroid, and it could be food sensitivity, viruses, metals, etc. And we talked about this in the past. But people don't realize that the gluten problem or the thyroid problem will eventually lead to a cerebellar problem or a brain problem. One, because of the immune response and inflammation that affects the stomach, let's say, that will eventually lead to brain fog. Okay? But just because of the molecular mimicry or the way things look, and they look very similar, your immune system gets confused into attacking its own tissues, especially the thyroid and cerebellum. So the cerebellum is a big old processing center, right? And it's responsible for things like eye movements, postural stability, trunk movements, cognition, fine motor planning. So it has a lot of different functions outside of just balance. So when we look at it, the midline, right, is responsible for the spine and eye movements, right? Eye movements and truncal stability. And then you have the intermediate areas, which is affecting your shoulder girdle muscles and your hip joints. And then the outside or the lateral portion of it is more of the cognition and the fine motor movements. So let's take a quick test of what can happen if you have cerebellar degeneration, right? So let's say after an infection or gluten sensitivity and thyroid issues or a traumatic brain injury that affects the cerebellum, some of the tests that we do in the office is eye movements. Obviously, I can't demonstrate that on a video like this because if you have to look at an eye movement and determine what's going on with the cerebellum. So that's a little bit more complex, and that's done in office. But one thing we can do is, what we can do is called a Romberg's test. So you put your feet together. So this is where we do the test together, right? So you stand up, and make sure you have a chair behind you or you're next to a wall, because I don't want you to fall over and injure yourself, right? If you do have a cerebellum problem. So what you do is you put your feet together, eyes open, bare feet, right, without your shoes on, right? Are you ready? So take off your shoes, stand barefooted, put your feet together. Now, one, can we balance in that position, just having your feet together? Because what happens is when you narrow the gait, it stresses the cerebellum even further because your base is smaller, right? So now you're barefoot, put your feet together, and then what you want to do is close your eyes. When you close your eyes, are we swaying a lot? Are we tilting? Or are we even taking a step, right? If you're doing that, you've basically failed a cerebellar test. Because when you take the eyes or the visual fixation out of the equation, when you close your eyes, the cerebellum has to work extra hard for that proprioception. So when you close your eyes with your feet together, barefoot, and you start to teeter-totter and you fall over, right? It's a problem. That's a more significant problem. Now, if you put your feet together and you close your eyes and you're kind of a little bit wobbly, but you're not falling over, another advanced test would be what we call a tandem Romberg, or just kind of heel to toe. So you put one foot in front of the other, right? Let's do that. Put one foot in front of the other, heel to toe, and just stand there for a second. Can we do that? Are you able to stand with your feet one in front of the other, heel to toe, and not fall over? If you start to teeter-totter and fall over, we have a problem. The more advanced test of that is one foot in front of the other, and then close your eyes. If you have a healthy cerebellum, you should be able to stand there for a period of time before you need to, take a step or open your eyes so you don't fall. So if you have your feet together, back to back, close your eyes, you should be able to stand there for a good, 20 seconds to 30 seconds. If you fall over, it's a problem. Okay? Another test for cerebellum is what we call DDK, right? So when we do this, let's say with your hands, so can you see my hands? We're going down, up, right? So we're doing this type of movement. Can we do it, right? Do we have a smooth movement where you're going down, up, down, up, down, up, down, up, down, up, down, instead of, and you get confused? So this is another thing that we can check for cerebellar dysfunction. Can we actually do that, right? Can we take our hands and kind of move it in a very smooth motion, like playing a piano? What I find is sometimes if you have cerebellar dysfunction is your hands will not move in a coordinated movement, or all three fingers may move at the same time rather than being a wavy movement. Okay? Another cerebellar test that we do in our office is basically finger to nose. So if you had like this, and you close your eyes, and you try to take your index finger and you put it on your nose, one, can we do it? Or are we completely missing or overshooting our target? Two, as we bring it in, does our hand shake? If our hand shakes as you get closer to the target, that can be an issue with the cerebellum. Or what you can do is you touch your nose and reach out as far as you can away from your body and see if your hand will shake as you go further away. So a good way to do that is you put a target on the wall, put your feet together, put your feet together, touch your nose, and try to reach out and touch the target. And see if you shake or you actually miss your target the way you want to hit it. Okay? So that smooth movement is the cerebellum. If that smooth movement starts to break down, that indicates a cerebellar issue. So when we look at cerebellum, we don't just look at it for balance, but we also look at it for movement, eye movements, cognition, or something called ataxia. Can we walk in a normal fashion? Or are we walking with our feet wide open like this, trying to get our balance? I find a lot of diabetics walk like that. They're trying to keep their balance, right? Or do they have an intention tremor? Are we getting a tremor as we start to move our hands? Or dysmetria, meaning you're not able to hit your target the way you need to. So you tend to knock over things when you reach out for something. Or sometimes they get a head titubation. So I said spinal muscles, right? And eye movements. So you have some people who will have a head shake, right? And that's kind of like this. Or they'll have a head shake as they bring their finger to their nose, they'll start to shake their head, right? So you might want to videotape yourself when you're doing these movements to see if you actually have it, or let someone else look at you when you do it. Sometimes you don't realize that you even have a tremor. Dysarthria, or speech issues, where we have what we call saccadic voice, right? Your voice will tremble, okay? Or dysphagia, or difficulty swallowing. That's another sign of a cerebellar issue. Now, that's what I just talked about in terms of cerebellum is pretty simplistic. It's more complicated than that. But if you did those self-tests, you can figure out, do I even have a cerebellar problem or not? Right? The people also who have cerebellar issues are people who have what we call external ear problems or peripheral vestibular problems, right? Otoconia issues, these little stones in your ear that can create dizziness and so forth. They may also have cerebellar issues. Or post-infection. If you had an infection, let's say of the vestibular nerve, after the damage, the cerebellum has to take a bigger role in terms of improving the balance and so forth. So when you have damage to the peripheral vestibular system, then your central or your cerebellum has to take a bigger burden. So a good cerebellum can be an indication of a healthy person. If you failed those tests that I just mentioned, then you may have a poor cerebellum, you might have a thyroid issue, you might have a traumatic brain injury, or you might have a food sensitivity. So this is what we do in our office. We try to take the patients who come in with complex issues, and we try to connect the functional medicine aspect of it, right? What is the person's whole body telling us, and how do we correct some of those issues? Is it affecting the brain, or is the brain affecting the organ? And then have an approach where it's holistic, so you can approach all of it together, rather than I just want to do one thing and hope for the best. So if we have a person who has gluten issues and thyroid issues, then we're certainly going to check for the cerebellum and make sure that's healthy, and then address those issues that show up in terms of their balance and movements and tremors and so forth. Okay? I hope that made sense. I'd like to welcome our new subscribers and the people who have liked and shared our videos. That's how we grow our practice, is that the people who watch send it to the loved ones and family, and share this information, because it can be very valuable in terms of figuring out some of these complex cases. Okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week at 12:30. All right? Have a great day.